Hi, this is Unit 8, Management of the Patient with Musculoskeletal Problems. This is Mrs. Mulcahy. I've chosen to use this format to deliver the content based on feedback that I've gotten from students. Some students work better with a lecture because they're auditory learners. Some are more visual, some are more hands-on. And because sometimes class time doesn't permit for all of those different strategies to be used at once, I've decided to give you the lecture in this way. The other advantages to having it like this is that you can take notes as you go, back things up, stop when you need to stop to write things down or take a break. You can rewind things to a place so you can listen to them again if they don't make sense to you the first time. And you'll have it to study for exams. And there'll be no question of what did she say about, because you'll be able to see it. You'll notice that the videos are arranged in a playlist, that they're relatively manageable in size. I won't say they're short. The shortest one is maybe 25 minutes. But at least they're a little bit manageable, and you'll be able to sort of break that content down into chunks. So let's go through your learning objectives, and you'll find these on your outline, the one that we gave you in the beginning of the semester in that yellow packet. And we'll talk a little bit about how I've decided to rearrange the order of some of these things to make more sense for me, but all of the content is covered. So let's begin. Lesson objective number 1 is to use the nursing process as a framework for the patient with musculoskeletal problems. Lesson objective number 2, we're going to plan care for the patient with a cast. And there is a pretty substantial amount of content on patients with fractures that goes with the casting content traction. We're going to plan care for the patient with traction. We're going to plan care for the patient with amputation. We're going to plan care for the patient with an internal fixation. We're going to plan care for the patient with a total hip arthroplasty and total knee arthroplasty. We're going to plan care for the patient with a metabolic bone disorder with special emphasis on osteoporosis, although we will be covering other bone disorders such as Paget's disease and osteomalacia. And we're going to plan care for the patient with a bone infection, otherwise known as osteomyelitis. So the way that I've broken this content down, we'll have a part 1, which talks about assessment and diagnostics, and then we're going to talk about trauma to the musculoskeletal system. For example, your soft tissue injury and your fractures. Once we get through those discussions, we'll be able to talk about the treatment modalities for patients with trauma, such as casting, traction, external fixation, and internal fixation. And although your outline lists them in a different order, I've chosen to take all of the treatments for fracture and put them in sort of one category. And that makes sense. Most of the other med-surg content is organized the same way, where you have a disorder, and then you have the treatment, and then you go on to the next disorder within that system. So we will start with injury to the musculoskeletal system. And this is probably our most substantial content, so make sure that you're taking breaks as you need to. And one thing that I'm asking for people to do to maximize our class time together is to write down at least one point where they learn the most, the concept that is clearest to them, that makes the most sense. And then on the opposite side, have one card with the concept that is still unclear to you, or the concept that was most difficult for you. And we'll see if we can base some discussion off of that. You'll see that Hinkle and Cheever is referenced in a lot of the slides. All of the content is going to be found in your textbook. I've tried to embed some videos. It's not an easy process on this app, but so most of the time you'll have other sources for your information to sort of support what I'm telling you. Certainly you can post comments. This is all listed in YouTube, so under the community section you can post your comments if you have questions. And students can feel free to answer each other. I just ask that you remain courteous and professional in your postings and follow our social media policy.